What is cardiovascular disease? Cardiovascular disease, or CVD, is a chronic condition that affects the cardiovascular system and involves disorders of the blood vessels that can lead to complications such as heart attacks. Heart disease is the main form of CVD, but stroke, high blood pressure, angina, which is also known as chest pain, and rheumatic heart disease are also included. Cardiovascular disease is the number one cause of death in the United States for both men and women. It is also the number one leading cause of death for most ethnicities. In the United States, 23.8% of deaths in both African Americans and Caucasians are attributed to CVD. However, CVD is the number two leading cause of death just behind cancer for American Indians or Alaska Natives, as well as for Asians or Pacific Islanders. 18.4% of deaths are due to CVD for American Indians or Alaska Natives, while 22.2% of deaths are due to CVD for Asians or Pacific Islanders in the United States. The etiology or cause of cardiovascular disease is attributed to genetics and the environment, though many risk factors are involved in making people more susceptible to developing cardiovascular disease. High blood pressure, high cholesterol, diabetes, and being overweight or obese are all other conditions that act as risk factors for CVD. There are also lifestyle factors that can increase one's risk, such as smoking, having a poor diet, being physically inactive, and/or drinking alcohol excessively. A study from 2010 was performed to find potential ways to reduce coronary heart disease in the United States. The study revealed that smoking and diabetes both had significantly high attributable risks for coronary heart disease, which is the most common form of cardiovascular disease. The odds ratios found for smoking were 2.52 for men older than 55 years of age. These odds can be interpreted by the following statement. Those men older than 55 years of age who smoke or have smoked had 2.52 higher odds of coronary heart disease than those who have not smoked. The odds ratios for women over age 65 who smoke or have smoked were found to be 2.14. Similar to the previous interpretation, these results can be stated as those women older than 65 years of age who smoke or have smoked had 2.14 higher odds of coronary heart disease than those who have not smoked. Diabetes was also found to be a major risk factor of coronary heart disease. Those men older than 55 with diabetes had 1.93 higher odds of coronary heart disease than those without diabetes, and those women older than 65 with diabetes had 2.59 higher odds of coronary heart disease than those without diabetes. Over 90 million Americans have a diagnosis of at least one type of cardiovascular disease. Therefore, the prevalence rate of CVD in the United States is about 27 to 28%. According to the Virginia Department of Health, in 2010, 5.9% of the state population was living with CVD. However, since the U.S. and Virginia rates have followed similar trends, this rate has likely risen since then. Although prevalence rates have risen for this particular disease, mortality rates have declined significantly for both Virginia and the United States as a whole. The rise in prevalence could be attributed to people living longer with the disease due to improved medical treatments. In 2016, the mortality rate due to CVD in Virginia was 150.7 deaths per 100,000 people, as compared to the mortality rate in the United States, which was 165.5 deaths per 100,000 people. Studies have shown that the prevalence of CVD in the United States and in Virginia are higher in low-income populations, populations with low education levels, and older populations. The Virginia rates have shown that men suffer from CVD more than women. However, the United States rates do not show a significant difference between genders. Cardiovascular disease can be prevented and/or managed through healthy lifestyle changes such as eating healthy, exercising, and quitting smoking for those who smoke. Taking steps toward a healthy lifestyle can reduce the risk of more severe factors and conditions that can ultimately lead to CVD. Treatment for individuals at high risk of CVD can be administered through drugs to reduce high cholesterol levels and hypertension or high blood pressure. Typical treatment for more severe and acute cardiovascular episodes may include surgical interventions such as coronary artery bypass, balloon angioplasties, valve repair or replacement, and implanting pacemakers. Cardiovascular disease is addressed by all 5 objectives of epidemiology. One that has been significantly applied to heart disease is the evaluation of preventive and therapeutic measures. Multiple studies have been performed in hopes of finding more and better prevention methods, as well as therapeutic measures for treatment and management of existing heart conditions. Supplements such as vitamin E have been explored for their effects on cardiovascular disease. One study showed that vitamin E had no significant impact on major cardiovascular events. However, it did appear to reduce mortality rates in women due to CVD. Although the ultimate goal is to reduce the case prevalence of the disease, reducing the mortality rates is a step in the right direction. Another study done in India explored public health interventions for preventing cardiovascular disease. Researchers found that the Indian population lacked translation of research to policy from bedside to community, meaning although prevention efforts have been put forth in research and possibly clinical trials, India was having trouble applying that research to the public health of the nation as a whole. It was found that lack of global public health guidelines and tools and cost of public health interventions were barriers faced by this population. These findings tell researchers that third world countries may not have the resources and information to apply public health policies. However, it was also found that controlling consumption of tobacco, alcohol, salt, sugar, and fat, as well as promoting physical activity and fruit and vegetable intake, can significantly reduce the risk of mortality due to CVD. Knowing this, public health advocates in India could raise the prices of the harmful substances and promote the use of heart-healthy factors. Knowing the status and reasons behind cardiovascular disease in India and many other countries, the CDC has put forth multiple goals for chronic disease prevention and health promotion. These goals include reducing the onset of chronic health conditions to begin with, improving health equity among populations, accelerating the translation of scientific findings from the lab and clinical trials into community practice, and promoting social, environmental, and systems approaches that support healthy living. A major point to take away from this is that the United States is trying to shift from a treatment-based healthcare system to a prevention-based healthcare system, because preventing diseases altogether saves lives, time, and money. In the United States, February is known as American Heart Month. Efforts to raise awareness are expanded during this month through local heart walks, wearing the color red, other local events, and fundraisers for research. To sum it up, prevention is the best form of treatment. It slows or even stops the onset of certain diseases that are essentially preventable in nature. Although some diseases cannot be stopped due to genetics, their onset can be delayed, giving individuals a longer quality life. Many efforts locally, nationally, and globally have been put forth to raise awareness and promote the idea of prevention for multiple diseases, including cardiovascular disease.